October is Breast Cancer Awareness Month. So today we have a mini health fair here with a focus on cancers. So here we have a few different services from the Ministry of Health. There's the breast cancer, the chronic disease unit that deals with cancers and other NCDs. We have the maternal child health unit, the men's health and women's health units, adolescent health units, and as well there's the blood bank services that are here. So we're all offering services here, including not just limited to breast cancer screening and examinations and breast education, but we're also doing cervical cancer screening in the form of VIA testing. We're also offering some amount of pap smears, and also we're collaborating with the NGO, the Guyana Cancer Society, to offer some HPV testing, which is also for cervical cancer.
So, I'm basically a medical oncologist specialized in treating cancer. And it is a huge problem. I have been doing this for the past 42 years. And obviously, I've seen over 10,000 cancer patients and treated them. But I don't want to see another cancer patient. Instead, I would prefer to prevent 10 million people from getting cancer. Because here's the thing, 70%, maybe as much as 80% of cancers are preventable. Yet every year, about 15 million people die globally from cancer. And most of it is in low and middle income countries like Guyana. Okay? So we need to do a better job of actually preventing cancer and screening for early detection. There's over 100 different types of cancers.
Oh, wow. Can you name a few for us?
Yes, top cancers are lung in men and women, breast, cervical cancer, prostate, colon, stomach, liver, kidney, you name it. Brain cancer, and those are what are called solid tumors, right? Then you have the hematological malignancies like leukemias, lymphomas, myeloma. Those are blood cancers. So cancer is a huge disease. If you're below the age of 70, cancer is the number one cause of death. And by 2030, cancer will be the number one cause of death that will be greater than heart disease, which is the number one cause at the moment.
So as the name said, it's the chronic diseases unit, or we would say the non-communicable diseases unit. Here we would normally help with the treatment and management of some of the chronic illnesses, primarily high blood pressure, where we're actually launching the Hearts Technical Package to help control high blood pressure and avoid cardiovascular diseases. We look at diabetes. Here we help to monitor and treat all the type 1 kids across the country. And we also are in the midst of with some discussions to have treatments available for type 2 diabetes. We're going to make some new protocols. The third one, we help to oversee cancers, primarily breast cancer and cervical cancer. There's another department who is attached to the Ministry of Health, the men's health. They help with, for example, prostate, etc. And the fourth disease we would normally oversee in this department is the chronic lung diseases, for example, asthma, COPD, emphysema, etc.
Okay, so the vaccines available at our booth here is COVID-19 vaccines, also HPV vaccines.
Okay, and the COVID-19 vaccine are for all age?
The COVID vaccines are from 5 years onwards. 5 to 11, we have children vaccines and adults COVID vaccines.
And the HPV?
Okay, it's available to everybody, to the public, but from ages 9 years to 45.
I believe to educate our people about life, the health, how to live healthy, how to eat healthy. And that is a main thing in society today. For example, you have a booth there which able to tell you of a soda, how much sugar that soda contained. And sugar is something we have to be very careful these days with. because of the diabetes that arising in our country. Um, so it's the health fair is, I believe, is well planned, and I believe it's something that will able to educate our people, and more like this should take place throughout the country. Okay.
Do you see, as you're walking around and observing, do you see women that are scared or they're eager to get tested?
No, I believe people want this kind of attention, and such a little booth. I find that a lot of women is there, they line up to just get tested, to just check themselves out, and I believe it's something that they want it, and they eagerly need attention of.
Now, what we are doing today, we are encouraging the general public or educating the general public about the harm of consuming these what we call carbonated beverages, or we layman term sweet drink. Now, what we wanted to accomplish today is for persons to actually see the amount of sugar that they put in their system every day. Now, for example, the Coca-Cola. We love this, right? Now, for some viewers, you might consume 2 to 3 bottles of this per day. Now, what we're actually consuming is 16 teaspoons of sugar. Now, I wouldn't take a cup, put 16 teaspoons of sugar in it and eat it, but that's what we consume on a daily basis. Now, what we're advising, what our recommendation is water, to use more water, to use your fruit juices, you have more fruits, more vegetables, and that will offset the chance of us troubling or having all the host of chronic complications that we have, like same cancers, high blood pressure, high blood sugar as well. So we want the general public to actually have a look and understand the amount of sugar that we put in our system. And might I mention, it's recommended that you use 7 teaspoons of sugar. Now that 7 teaspoons of sugar comes from all the foods that you eat from breakfast to dinner. So think about it, 7 teaspoons, and I've already consumed in 1 bottle of Cokes 16.
October is Breast Cancer Awareness Month. With me is some beautiful young ladies. They're representing the Peri-Wrinkle Cancer Club. Did I get that right?
Yes, yes, you did.
And with us as well too is 2 breast cancer survival. We have Miss Smith, and we also have Miss Singh. How are you guys doing today?
I'm okay, I'm doing fine.
All right. And how are you doing?
I'm okay, I'm trying.
All right. First of all, can you tell our viewers how long have you been a breast cancer survivor?
I'm a breast cancer survivor for 2 years now. 2020, I did my surgery, and I'm okay, and I'm doing fine.
All right. How did you find out that you have breast cancer?
It was a self-examination. On one day I was examining myself, which I normally do like twice a week or so, and this day I felt that I had a lump in my breast. And immediately after, the very next day, I went to the hospital and did a breast CT scan. And there it was diagnosed that it was an early stage of breast cancer.
I felt a lump in 2007, so I went to check it out with the doctor. And after that, I had a biopsy. The biopsy came back and it was positive that it's cancer. So from then on, I had the surgery, I had the medication, the treatments, the therapy, everything I had. And then I am still here in 2022, and I am 15 years as a survivor.
And that's what the forum is all about. Periwinkle came into being because some female survivors, and remember most people know that women have breast cancer, but we want to remind them, all of us, that men get it too. So they wanted this forum where they can share their survival stories, they can meet and greet and learn together, because it's an experience and you grow from it. 17 years for Rita, that's a long time, so she has a lot to tell. And even though, cancer is of such that you have to keep learning, you have to keep doing the right thing, so it's a constant story. And that's why we are here, to help survivors and to support them.
Does this group just have ladies, or you have any?
Well, we started out with women only, but then men have joined us because we're no longer just breast cancer. We are cervical, our male survivor, he has prostate cancer, just one. We find the men don't come every time we get one, and then unfortunately, the two that we had, they passed on, but now we have one. So we want to encourage men to, to go get those examinations done. It's important.